Hello, my name's Taylor, and today I will be going over the one-man crime wave relating to the pain management crisis. Um, so jumping right in, this is a podcast that goes over the crisis of overprescribing opioids relating to one provider alone in the state of Kentucky. The provider at hand that we're speaking about today is Dr. Gott. He was a cardiologist turned pain management provider in Kentucky in 2016, who was mainly providing methadone to his patients. He was providing methadone and prescribing it to his pain management patients. But Gott was also caught billing EKGs and spirometry tests every 3 months. EKGs are for cardiology patients, and he was no longer a cardiologist. He was a pain management doctor. And then spirometry tests are for people in respiratory distress. So that's a respiratory test. And these were being billed every 3 months on these patients, even though that's not a typical test that a pain management provider provides. They had nothing to do with his pain management at all. He wasn't offering or billing any other tests that pain management providers do offer, such as MRIs to kind of pinpoint where the pain is located, or offering and suggesting physical therapists to hopefully treat the pain in ways other than just prescription drugs. No, what he did was he would prescribe methadone. And this one wasn't offered very often. Usually like other opioids, such as like oxycodone and such. Opioids like that. Methadone wasn't a big one that was prescribed very often. But when he prescribed methadone, there were some positives to this for him. His patients would start coming back weekly, and then every 2 weeks. So he would get more regular visitation. Also, since there wasn't very many methadone providers, when he would prescribe methadone and get his patients addicted to methadone, he would be one of the only people in the area. So he would track in more business by getting these people addicted, and then also being one of the only people to actually provide that specific drug. So these were all helping him get more money in his pocket. And that was the reason in which he provided methadone. He was actually one of the top providers of methadone in the state of Kentucky at the time. And since he was one of the top providers, when he got caught, it was a big thing with the FBI and the DEA working together to kind of crack down, especially on the overprescribing of opioids. And relating this back to things that we talked about throughout the semester, this I feel would relate most to talking about the opioid crisis when we talked about OxyContin and the overprescription of that back in the 90s. And just how when doctors are constantly overprescribing things, like when Purdue got caught overprescribing OxyContin, just for extra money in the pocket, it becomes a serious problem. And people become addicted, and especially in these small rural areas in which this specific instance occurred with Dr. Gott, it becomes a much larger deal within the community, and it really does affect the community because you have all of these people hooked on these opioid drugs in a smaller community, and it really does show. So, looking back on it, the regulations on opioids should be monitored, and there should be regulations cracked down. Just because there's so many outside effects, and watching what the doctors are prescribing and such is super important. And there's so many other ways to treat these things other than just drugs. But that was all for this podcast. Thank you for watching.